Bronchodilation is the relaxing of bronchial smooth muscles. It is caused by the sympathetic nervous system. Cyclic AMP, or the second messenger, is the substance that causes bronchodilation. ATP is broken down by the enzyme adenyl cyclase, which creates cyclic AMP. A bronchospasm is the constriction of bronchial smooth muscles. It is caused by parasympathetic nervous system. Cyclic GMP is the substance that causes bronchoconstriction. GTP is broken down by the enzyme guanyl cyclase, which creates cyclic GMP. Three causes of bronchoconstriction are bronchospasms, edema, or secretions. A balance of GMP and AMP keep airways open at their maximum diameter. The origin of bronchodilators. Catecholamines were the first type of bronchodilators. They are very strong with rapid onset and a short duration, making them not good for maintenance. They are also deactivated by enzymes COMT and MAO, which are found in the liver and kidneys. And they can only be given as an injection or inhalation. Four types of original catecholamines are epinephrine, norepinephrine, dopamine, isoproterenol. Epinephrine stimulates alpha and beta receptors and is used as cardiac stimulant and for acute asthma. Now it is mainly used for emergencies and acute allergic reactions. Resortinols are a modified catecholamine. They were the first real maintenance drug. They had a longer duration and are more beta-2 specific due to the longer side chain. And they can be taken orally. Alupant was a resortinol beta agonist drug that is no longer used. Saligenins are the final modification of catecholamines. They are the most common bronchodilators. They are the most beta-2 specific and have a long duration of 4 to 6 hours. They can also be taken orally. The most common saligenins used today are Proventil or albuterol and Zopnex. Three types of bronchodilators are adrenergic, anticholinergic, and xanthin. Adrenergic are also known as beta agonists and front-door bronchodilators. They are the most common inhaled aerosols, and they actively affect receptors in small airways. How adrenergic affects receptors? In alpha receptors they cause vasoconstriction. In beta-1 receptors they increase the heart rate. In beta-2 receptors they relax the bronchial smooth muscle, stimulate mucus clearing and stop inflammatory mediator release. The routes of administration are inhaled, which is preferred. The nebulizer, which is used to manage severe asthma attacks and avoid intubation. Orally, which is typically not preferred. And parenteral or IV, which is used for emergency of acute asthma with epinephrine. Short-acting beta agonists are the rescue or reliever meds. They have a 4 to 6 hour duration and are used for acute reversible airflow obstructions. Proventil, generic name albuterol, has a regular dose of 2.5 mg and a 4 to 6 hour duration. It has many different forms. Zopnex, generic name levobuterol, is a derivative of albuterol. It has 3 dose sizes: 0.31, 0.63, and 1.25 mg, with a 3 to 8 hour duration. It is stronger and has less side effects than albuterol. It comes in a MDI or nebulization. Microepinephrine or asthmaepinephrine, generic name racemic epinephrine, is ultra-short with less than 3 hours of duration. It is inhaled by aerosol and is distilled directly to lungs. It stimulates alpha and beta receptors and is used for patients recently extubated, patients with epiglottitis, bronchiolitis, or to control airway bleeding from endoscopy. Long-acting beta agonists are maintenance or controller drugs because of their 12 to 24 hour duration. Vospire ER, generic name albuterol extended release tablet, comes in a 4 or 8 mg tablet size. It has a 12-hour duration or more. Serevent. Generic name Somaterol. Comes in a DPI. With a 12-hour duration. Bravana. Generic name Arformoterol. Was FDA approved for maintenance of COPD. It is used as a nebulizer only. And has a 12-hour duration. Performist. Generic name Formoterol. Is only for COPD. And is used as a nebulizer only. It also has a 12-hour duration. Arcapta. Generic name Indaterol. Comes in a neohaler DPI. And is used to treat COPD. It has a 24-hour duration. Striverdi Respimat. Generic name Iladaterol. Is used to treat COPD. But has no FDA approval for asthma. It has a 24-hour duration. Vilanterol. Is FDA approved for a fixed combo use only. Brayoilipta. Is a DPI that contains vilanterol and fluticasone. It has a 24-hour duration. Anoroilipta. Is a DPI that contains vilanterol and imiclidinium. Anoroilipta is actually a beta-anticholinergic combination. It also has a 24-hour duration. And is used for low airflow limits in COPD patients. Long-acting beta agonists in clinical use are used as maintenance therapy for asthma that is not controlled by low-dose inhaled corticosteroids or COPD patients needing daily bronchodilators. Long-term use. Regular long-term use is not recommended. One reason is that chronic patients may build a tolerance. Also, you need to monitor pulmonary function results and make sure the patient is educated if used long-term. FDA guidelines for long-acting beta agonists. They are for short-term use only. And they need a controller medicine such as a corticosteroid. Anticholinergics are backdoor bronchodilators. They target larger airways. And are used for maintenance of COPD, chronic bronchitis, emphysema and asthma. They are also used in nasal sprays to decrease nasal secretions. Atrovent is a MDI or nebulizer. And is the only anticholinergic approved as an aerosol. It is used for COPD maintenance. And it has regular 2.5 ml unit dose for the nebulizer. Spiriva is a DPI that is long-acting for up to 24 hours. And is used to reduce COPD exacerbations. Tudorza is a DPI that is long-acting for up to 24 hours. And is approved for COPD maintenance. Incrusalipta is long-acting for up to 24 hours. And is also for COPD maintenance. Beta and anticholinergic combos. Combivent and the Duonep, which is Atrovent or generic name ipratropium and albuterol together. Remember this one. Combivent is ipratropium and albuterol. Sciolto is long-acting for up to 24 hours. And is not recommended for acute asthma or COPD. Adverse effects of combos. Most common is dry mouth. Also, if it gets in the eyes, could it cause dilations? When administering combos, beta should be done first, then anticholinergic. Xanthine is also known as methylxanthines and Sidora bronchodilators. The three types include caffeine, theobromine, and theophylline. Caffeine is found in cola and coffee beans. Theobromine is found in cocoa beans. Theophylline and caffeine is found in tea leaves. Xanthine uses are not for acute symptoms or children under 5. However, methylxanthines are used to stimulate breathing in apnea of preemies, typically caffeine because it penetrates CSF better and less side effects. Other xanthine effects are that it will stimulate the CNS and cardiac muscle. It will relax smooth muscles. It will cause peripheral and coronary vasodilation and cerebral vasoconstriction, as well as diuresis.